Great. Okay. Hello, my name is Kelsey, and I will be presenting on the literature review I undertook during my practicum experience this past semester called Centering the Person in Personal Identification and Health, a Scoping Review. So first, I'd like to take a moment and acknowledge the Lekwungen peoples on whose traditional territory I live and had the opportunity to complete my practicum, and the Songhees, Esquimalt, and Wasanich peoples whose historical relationships continue with the land to this day. So I completed my practicum at the Community Social Planning Council of Greater Victoria. This is a nonprofit organization that offers a variety of programming, research, and partnerships to address social issues and promote social justice within Greater Victoria. Specifically, I worked within their Coordinated Identification Services program. So this program provides services that help people acquire personal identification, such as birth certificates and government-issued photo ID, recognizing that ID is necessary to access vital services such as housing, income assistance, and a range of health and social services. So through my experience in this ID program, I saw firsthand the many barriers that folks face to acquire their ID and how this impacted their ability to access life-sustaining supports and services. So for instance, many of the folks I worked with were experiencing homelessness and were unable to secure housing or get a job or access their bank accounts until they had ID. And many expressed that they felt stuck and unable to move out of their circumstances that they'd found themselves in because they were unable to access ID. So seeing this, I wanted to explore what the literature had to say about the relationship between personal identification and health. And in conversation with my practicum supervisor, I undertook a scoping review on this topic, which the practicum organization plans to use as an evidence base to help inform their evaluation planning for the program as well. So project methods, I used the JBI manual for evidence synthesis and Prisma to guide the methods of this scoping review. And the research questions I aimed to explore were: one, how does having or not having personal identification impact health and the social determinants of health? And second, how do barriers to accessing or lack of personal identification disproportionately impact certain populations? A literature review was conducted of both academic and gray literature using predetermined search terms and inclusion-exclusion criteria. And after the search, 51 articles were included in my review. The results of the review were organized into 3 themes. So the first theme looked at personal identification and the social determinants of health. So the literature showed a wide range of impacts on access to the social determinants of health, including a variety of health and social services, such as food banks, community naloxone kits, and disability support programs, as well as the ability to get employment, to access housing and education. The second theme looked at personal identification and personal health. So looking at the impacts on physical health, mental health, and well-being. And much of the literature within this theme discussed transgender and non-binary populations and the association between discordant identity documents with poor mental health outcomes and increased rates of suicide ideation and attempt. And then the third theme discussed the disproportionate impact that lacking personal identification or facing barriers to accessing it had on certain populations. And the populations most represented in the literature included in this review were people experiencing homelessness, immigrant populations, transgender and non-binary populations, incarcerated peoples, racialized communities, and Indigenous peoples. So the implications of the review. First, the results of the review strengthen the assertion that since the barriers to obtaining ID and the increased need to show ID to access many of life's essential services contribute to health inequities, personal identification policy is in itself a determinant of health. And second, the implications of this review discuss how public health has the potential to bring a social justice perspective and increase the inclusion of equity considerations into personal identification policy. So the review looks at 2 ways this could be done. One is to evaluate the necessity to provide personal identification for all essential services. So using a health equity lens could allow for a better evaluation of when it is truly necessary to provide ID, especially when it's impacting the ability to access life-sustaining services. And second, to reduce the barriers to obtaining personal identification through a tailored approach and policies. So the results of this review help portray how reducing barriers to obtaining ID has the potential to improve the health and well-being of many people. And the use of a health equity lens could allow for greater awareness of the barriers certain populations face and allow for targeted services to meet those needs. Limitations. So further research is needed that examines the relationship between personal identification and health. While personal identification was included in many of the studies, it was rarely the primary aim of the research. So the association between ID and health is likely underrepresented in the literature. And in addition, the disproportionate barriers to obtaining personal identification for certain populations and the implications for health equity mean that specific research is also needed that can be used to help inform programs and policies that can effectively address these barriers. So in conclusion, this review helps portray how personal identification fits within the field of public health by showing the wide range of impacts on health, the social determinants of health, and the implications to health equity through the disproportionate impacts shouldered by certain population. And it also presents an opportunity for public health to contribute a health equity and social justice perspective to the barriers and concerns surrounding ID access and policy. I just wanted to take a moment to say thank you to my practicum instructor, Dr. Jeff Masuda, my practicum supervisor, Diana Gibson, and all the lovely folks at the Community Social Planning Council. And thanks to everyone here for listening to my presentation.